Hello, this is Dr. Jacobs. I'm with the Memorial Rehabilitation Center and the residency program down here. Can I get some confirmation you guys can hear me and see me here?
Yes, you're good.
All right, perfect. So we appreciate you guys allowing us to participate in today and this evening. It is about 9 o'clock at night over here in Southeast Florida. We have some beautiful weather, as always, and it's been a spectacular weekend. So we are looking forward to telling you a little bit about the program, some of how we have designed and look to continue to implement the curriculum and the rotations here. And then we really want you to hear from some of our residents. So I'm Jeremy Jacobs. I'm the program director. I've been working for the Memorial Healthcare System for about 6 years. I've been the program director for a little bit more than a year, and I've been part of the design team for the residency program, the space, and everything else. So I just want to welcome everyone. And again, we're going to have you talk to some of our residents because I really want you to hear from the people who are on the front lines and working and kind of working, but also enjoying our plan here. So in Hollywood, Florida, we are between Fort Lauderdale and Miami. We have a spectacular inpatient and outpatient PM&R program. We've got 89 inpatient beds, and we have all the normal specialties that everyone has: brain injury, spinal cord injury, general orthopedics, a significant population of strokes. And we're close to a couple of other programs down here in South Florida. And it really is, well, when we designed this program, we wanted to make a residency program that residents and students can learn from, feel appreciated and respected, and get all of the necessary experiences that they needed to graduate as competent and confident physicians. But at the same time, we really wanted to minimize some of the time that was what we felt wasted in our respective residency programs. So as a faculty, we got together and we said, what did you enjoy about your residency program? What did you not enjoy about your residency program? And as we design our program from scratch, what do we want to make sure that is involved, and what do we want to get away from? And at this point, I think it really has kind of helped us to set ourselves apart, aside from the fact that we really enjoy doing what we're doing. We love to work on our jobs. We love to take care of our patients. We love to work with our students and our residents, and we really enjoy our day-to-day lives. But we also just want to make sure that the days for our residents are full of learning and full of motivational experiences and positivity and all the things that we decided to do PM&R for. We want to make sure that patients' lives and experiences are improved. We want to make sure that the function of these patients are improved. We want to make sure that the families are educated and well informed on their care. And that's really the bottom line. And every single day we want to do this job. We want to continue to go into work, and we want to enjoy what we're doing. And we want our residents to learn that and live that life as well. And so one of my biggest goals as the program director of this new program down here in Southeast Florida is to just have our residents to be a part of our day-to-day and our patients and our families' experience. And really to just make sure that the patient care and the patient safety and all of these things that come into the future of medical care are in there. So really quickly, I'm just going to tell you a little bit about our system. We are a 5-hospital system down here in Southeast Florida. We're about 20 miles north of Miami. We are about 7 or 8 miles south of Fort Lauderdale, maybe 40 miles south of West Palm Beach. All of our hospitals are within a 10-mile drive. Our residents spend most of their time in our 89-bed inpatient rehab hospital in their PGY2 year. In their PGY3 year, they expand their experiences to Joe DiMaggio Children's Hospital, which is an absolutely spectacular place. They get inpatient and outpatient experience there over 2 months. Memorial Hospital West is a designated cancer center where they get a lot of experience with consults, inpatient, outpatient as well. And then Memorial Regional Hospital, which is our level 1 trauma center. And at that location, we are doing consults, we're doing neurology, we're doing EMG, we're doing trauma, spinal cord, everything else. We try to make the day-to-day life as easy as possible on our residents, because we know that it's not easy at all to be in a residency position with a residency salary, with loans and all those things. And so we provide parking for free at all of our locations. We provide all meals included in that for breakfast, lunch, dinner, whatever it may be. We have nice Keurig coffee machines, though I don't love the plastic waste by any means. But all those things make a big difference when it comes down to your day-to-day life. When you're trying to learn, trying to do didactics, trying to take care of patients, trying to do research and scholarly activities. So we feel that's important. We also provide 2 sets of scrubs and white coats each year for our residents, again, to just try to make sure that those things that we don't think about are all taken care of. We have an educational allowance of $1,000 per year for whatever it is that you may want to do. We don't ask any questions. We don't make sure that it's a textbook or whatever. So early on, it might be text, it might be a reflex hammer, it might be a conference, and later on, it might be a board review course or something else that's very specific. But we also allow $1,000 conference stipend per year, specifically in addition to that educational allowance, to ensure that our residents are going to conferences, presenting posters, and really getting involved in the academic experience. It's a win-win for all of us. I mean, it's great for residents to learn and to get educated on the aspect of evidence-based medicine, on patient care, on case reports, on quality improvement, on process improvement. But it's also great for the Memorial Healthcare program. So I want to see this right here, this Memorial M, on as many posters as I can see, because it gets our name out there. So it really has a significant benefit for both the residents and our program to go to as many conferences as possible. The residents get to experience what life is like on the outside. They get to meet program directors and residency and fellowship directors, and that really is an important part of it. And then outside of that, you know, we really just we try to live our lives as true and as enjoyable as possible. Again, residency is not easy for anyone. It is a learning process, and from an academic standpoint, from a lifestyle standpoint, from a learning how to take calls standpoint. But we really believe that if you treat everyone, including our residents and medical students, with respect and professionalism, that we're all going to be able to gain a significant experience from this. And that's how I want to be treated. That's how I want all my residents and students to be treated. That's how I want my employees to be treated. And I feel like if you build a program like that, you're really going to make it happen. So what I'll tell you is I'm going to let a few of my residents talk to you about their day-to-day life. I'm going to get off of this because I know that you guys want to hear from our residents. So my information is online. Please get on the website. Memorial Healthcare System is in Southeast Florida. It's a beautiful place. It doesn't snow and it doesn't freeze. And it really is as good as it can be. So I'm going to turn my video and my microphone off. And again, please email me if you have any questions. Our program academic associate program director is Dr. Joanne Delgado. She does an outrageous job. She is so awesome. She's got great energy. She's got great positivity. She runs the didactic program. And please, get a hold of her for the same thing, because I would not be able to do any of this without her or our program administrator, Anola Schroeder. So I'm going to hand this over to our residents, and that's all I have. So I hope to meet everyone here at some point when we can get back together in person. And thank you very much for having us again.
All right. Thank you, Dr. Jacobs. Hope you all can hear me now. Waiting for us to get on the screen. Hello?
I hear you and see you guys.
Perfect. All right, perfect. Wonderful. Thank you very much. And thank you to PM&R Scholars for hosting us all tonight, and for all the medical students in attendance. My name's Stephen Times. I'm a PGY3 here with my fellow PGY3 class. We are the first class within the program. I think, like Dr. Jacobs was mentioning for today, I think we'll just go through a bit about why we picked the program, what we think the strengths of the program are, and then if we don't answer any questions towards the end, you guys can feel free to ask anything you'd like. We also uploaded some documents to the shared drive with some more details, some facts about the program. You guys are more than welcome to check that out. So a bit about myself, like I mentioned, I'm a PGY3 at Memorial. I went to TCOM for medical school, so shout out to all the fellow TCOMers I see here in the chat and in the stream earlier. So I guess my first experience with the program was actually rotating as a medical student. And I really remember falling in love with the culture of the hospital and not even within like the physiatry program itself, but just the entire hospital, the staff, the nurses. I think everyone was really on the same, had the same goal of doing right for the patient. And I think that just really resonated with me and stuck with me. So I'm really glad I chose this place. Other strengths that I've found since then as well, I think we have a very diverse exposure to different patients. We see a whole range of different cases from amputations, ortho rehab, spinal cord injuries, brain injuries, strokes. We have a whole medically complex floor that we have very sick patients on that we get really, really great experience managing those cases. We have transplant cases coming through. It's a very good experience so that later on, once we see those by ourselves, we can feel a little bit more comfortable managing some of those things. Some other things I really like about this program are the attendings. I mean, you just heard from Dr. Jacobs himself. He's a great part of our program. He's a great leader. The other attendings as well, they're all fairly fresh out of their residencies and fellowships, very knowledgeable in their field. They know what's going to be tested on the boards, and they're very, very great to work with, and we learn a lot from them. Obviously, we have a categorical program, which is a great benefit too. We did our intern year not too far from here. So not only is that convenient for saving yourself a move within 2 days between your PGY1 and PGY2 year, but also you get to work with the attendings. A lot of times you'll be consulting the same attendings throughout your whole program. So the chance to get to know those attendings very well your first year and develop those relationships from year to year is huge for us. We do a lot of workshops, a lot of hands-on learning. We do ultrasound workshops, EMGs, a lot of hands-on exposure before working with the patients, and that's been very, very valuable. And like Dr. Jacobs was kind of mentioning as well, we're in the sunny Florida, so tons of outdoor activities. Yesterday I went mountain biking with one of our attendings, and today took my dog to the beach and got some sun. So plenty of stuff to do around here on your days off. You can pretty much every day of the year you can be outside and get some exercise and get some sun. I guess I'll hand this off to these other guys. They can kind of talk about their experiences and then go on to questions towards the end. So you guys want to pick it up?
Oh, yeah, I'll take over. So my name is Michael Boving. I am one of the other PGY3s hailing from the great state of Oklahoma. I don't know if there are any Sooners here, but probably not. So I think we'll start out with the reason why I ranked Memorial high on my list. And I think it comes down to predominantly, or first of all, the culture, which Stephen really kind of highlighted, which is really ingrained in the entire system. It is patients first. And there's a sense of doing the right thing for the patients, and the administration is very open to allowing you to do things that you might not be able to do at other programs. There's a lot of resources within the hospital system, and it really. What was that? Is that a 5-minute warning?
Yeah, 5 minutes.
Thank you. So that's one aspect of it. The other are the attendings are absolutely fantastic. Dr. Jacobs, who you've all now been introduced with, Dr. Delgado. We have Dr. Novick, who is a fantastic attending, and really engages in all aspects of PM&R, and he's very well respected in the field. We have a number of additions to the program as well. And I think I'll highlight some of the things that are kind of great. One, I think, is our inpatient experience is fantastic, and I don't think you're going to get much of a better experience just about anywhere else. Whether it be from our medically complex service, we get fed from Cleveland Clinic, a lot of other local hospital systems when it comes to transplant, because we have Dr. Salerno. He's double boarded in internal medicine and PM&R. So he is a great asset, and also the chair of the department. So really, the faculty are absolutely fantastic. They all support us. They give us a great deal of autonomy. We really take the reins, so to speak, when it comes to running team conference day one. It's a learning experience, and every hospital system does them a little bit differently, but it's definitely a good experience, and you get a lot of great feedback, and yeah, so.
You want to say a couple words?
All right, yeah. I don't know how much time I have, but I'm now on the third PGY3. And a couple of things to add on everything that already been said is that on top of that, the schedule we have is very manageable for the residents. Both intern year, for what intern year is, it's a very feared thing for a lot of medical students, but for us, it's just the right amount of exposure where we have enough learning experiences, but it's not like we're burnt out or anything. We still can have a life outside of our day-to-day, both in obviously the intern year and PM&R as well. And like Stephen was saying earlier, it's a fresh program, and there's just so much energy and excitement to everybody that's there, and that's not diminished in any way now that we're into our third or fourth year coming up. Like, everyone's so excited to have us and teach us, and it's a really exciting, energetic environment that you really can't, quantify in the number. But that's the general vibe. And another thing is that I'm going to get to the call in a second. Yeah, we have also a good exposure to MSK, both through our attendings here. We have MSK specific attendings. We have orthopedic sports attendings we work with as part of our sports medicine rotation. We have Dr. Jackson Cohen, who's an interventional pain specialist, who does see a combination of MSK and pain. And we have a whole entire MSK symposium.
2 minutes left, guys. 2 minutes.
Thank you.
Okay, so our entire symposium dedicated to just MSK. So the knowledge there is great. We have a budding research program here as well. Stephen and I are working on a couple projects already. It's not, you don't have to, but it's there if you'd like to. Much better than what most community hospitals programs do, I think. Great location, great weather, free parking, closed parking, free food. Yes, every single day, multiple meals. Great staff, great program director. And we have a very family environment here. We have a lot of good people in the program. The co-residents are awesome. You see 3 guys here. Don't worry, there's 3 girls in the PGY2 class right now. So we have a good diversity, and it's growing and becoming better and better every day, for sure.
Let's get to the call schedule. And then,
the call. Yeah.
So our call is definitely a huge perk, and as Dr. Jacobs highlighted, they designed the program so that we wouldn't have to do things that they didn't think were necessarily things that they thought they got the greatest benefit from. So our call schedule is a 24-hour call once a month. So PGY2s do Friday night into Saturday, PGY3s do Saturday into Sunday, and PGY4s I think are going to do Sunday into Monday. So we just cover the whole weekend throughout the month, so it's pretty great.
Now, I think one of our PGY2s is on some here. Matt Volker, is he on? Maybe not.
Maybe not.
Okay.
Yeah, maybe not.
What other questions do we have here? So we talked about the call.
The collaboration, other programs. We have a lot of good research we're doing right now here. Our hands are full for research if we want to do anything. So right now there's no collaboration, but I don't think there's any need, even though we're not an academic program per se, for research.
Mm-hmm.
And guys, thanks so much. That is the time limit, but we really appreciate Memorial Health. Excellent information. That was a great lecture and presentation. Thanks so much.